Hello and welcome to Cloth 400 screencast. In this episode we will discuss the hypertension template. Using our test patient, we will assume that this patient has been diagnosed with hypertension and we'll be launching the template to document that diagnosis. As you can see, this is a simplified template that walks you through the codes required for hypertension. In here, you'll be able to choose the appropriate code for hypertension. In most cases, it will be the essential hypertension, but of course, in some other instances, you may be able to choose other diagnostic codes. As you can see, all of these codes are relevant to the cloth work. Next here, obviously, you can see that you can record the blood pressure, and as you do, you will be able to see the recent blood pressure readings in here. In conjunction with that, you can also add the fact that whether this person is a smoker or not, and if they are, then obviously you can advise them on smoking cessation. In addition to the fact, you're able to advise them on lifestyle modification with regarding to hypertension management, and you can of course add further details according to that advice that you gave. The all too important and all too often forgotten fact that we need to document the cardiovascular disease primary prevention risk for these patients. When you click on that particular button, you are then presented with the CVD primary prevention template, and that will then provide you with the two fairly commonly used calculator to calculate that CVD risk, whether it's the CVD risk calculator for the 10 years risk or the Q risk calculator again. As soon as you click on either of those, you are presented with the details of this particular patient, the average of their last blood pressure measurements and cholesterols, etc. Once you've gotten to this stage, you can click on adding this particular code to the person's records, and that would satisfy the diagnostic criteria for managing hypertension. Of course, you also have the ability to add exception reporting for this particular patient, including the maximal blood pressure therapy at this point. I hope this was a useful recap of the hypertension template. Thank you.